Australian soldiers fighting in South Vietnam know that if they are wounded, a casualty evacuation helicopter will move them to a modern hospital within 15 to 30 minutes, quicker than a road casualty in Australia. A wounded soldier has immediate medical aid available to him. Help is provided on the spot by a highly trained medical attendant who gives life-saving first aid. Specialist aid is only a radio call away. Dustoff helicopters, which are on constant standby at the Australian Task Force base at Nui Dat, are guided to a pickup point by radio and a plume of smoke. Some casualties have to be winched through the jungle canopy to the hovering helicopter. Where a landing zone is available, casualties are loaded on the ground. The specially equipped aerial ambulance allows medically trained crewmen to continue the treatment begun on the ground. Aboard the aircraft, dressings are checked and further care given. Intravenous fluids and pain-killing drugs may also be administered. The pilot flies his patients to the most appropriate medical installation in the area. For Australians, it is the 1st Australian Field Hospital at Vung Tau, in the 1st Australian Logistics Support Complex on the shores of the South China Sea. The hospital is alerted by radio on the number of casualties arriving and the extent of their wounds, and skilled staff are waiting to treat them. This early warning from the Dustoff aircraft enables the hospital to mobilize all its resources for the reception of the casualties, so that when they arrive, attention is immediate and maximum. The Australian hospital has been described as one of the best in Vietnam. The 110-bed unit is a clean, air-conditioned haven in which diggers wounded on the battlefield and those who suffer from illness can recover. Treatment begun in the helicopter is continued in the casualty receiving area less than 50 yards from the helicopter pad. Wounds are expertly and speedily assessed, and when necessary, X-rays are taken, blood matched, and resuscitation treatment applied. Priorities are determined so that the more seriously injured can be treated first. The modern pathology laboratory provides the wide range of tests essential to modern-day medicine. Life-saving blood is available to blood banks throughout Vietnam, and from these banks to individual units as required. Donations from soldiers provide fresh blood when it is needed. Urgent cases can be moved directly into a twin-unit operating theatre. X-rays taken minutes before are there for surgeons to see the extent of the damage caused by bullets or shrapnel. Some leading Australian surgeons and specialists spend 3 months in Vietnam, working alongside army doctors to give the sick and wounded the benefit of their considerable skills. The surgical teams may work at separate tables or combine on behalf of one patient in the fully equipped operating theatres. Nursing officers and medical assistants of the Australian Army are essential members of the surgical teams. After surgery, patients are moved into one of the 7 wards at the hospital. Whether in intensive care or an open ward, the patient receives the highest standards of medical supervision. For the fortunate ones, the medical officer's round may be the greatest part of the supervision necessary. Others may have a medical team by their bedside 24 hours a day. As well as the medical care, Red Cross staff are available to do shopping and letter writing for those patients unable to do these things for themselves. Well-prepared meals provide a balanced diet. The hospital also provides sheltered garden areas and a Red Cross centre which includes a games room, letter tape room and library. The Peter Badco Club nearby, with its ocean beach, pool and cool gymnasium, makes special provision for the hospital patients. Some wounds or sickness can mean an end to a soldier's tour of duty in Vietnam. And the journey to Australia begins in a specially equipped air-conditioned bus. In Australia, the patients will be disembarked at Richmond RAAF base near Sydney for on-movement to hospitals in their home state. At the Air Force Base at Vung Tau, RAAF teams await their arrival, ready to transfer the patients into a giant C-130 Hercules transport plane. Casualty loading techniques are highly developed to provide rapid and comfortable transfer of patients. They are loaded in a set order according to their individual in-flight nursing requirements. The speed of the medical Dustoff, combined with the first-class facilities at the 1st Australian Field Hospital Vung Tau, have saved the lives of many Australian soldiers in Vietnam.